So when you're ready, you open your mouth and then close it all the way.
Oh.
One more.
Oh.
Got it.
Whew.
It didn't go through in the first blast, so I had to do one more.
Oh.
Got it.
Months for that. That's great.
So we have Sky here today, and Sky, we'll ask you a couple of questions about it, but you had a serious sports career. Yeah.
When I was younger, I did. I was a 3-sport player in college, and then went on to play some baseball in the minor league system.
Okay, cool. And you also played in the College World Series?
I did.
For what university?
I went to Pepperdine University, 1992.
And did you win that year?
Champs, yeah.
They won that year. They won the
We
College
did.
World Series.
Yeah.
To me, that's pretty huge because I really, I always love baseball, so I think that's really cool.
Yeah.
You also told me you had some back surgery, so let's.
I did.
And that's going to come up on this because you know how people who watch my videos know I very often do that side twist to get the lumbars. We won't be doing that today if you had back surgery. So what year did you have your surgery?
I had my surgery in 2004.
Okay, so that's 17 years ago now.
Yeah.
And it was the last 2 lumbars, perhaps?
L4, L5, and S1.
Yeah. Do you remember what they did a little bit so we can learn?
They set screws and they created space to give the
the disc.
The discs space.
And
it
give
really
it height.
gave me a bunch of relief. I was slumped over and trying to use muscles in my chest to make myself look like I was standing up straight. And over the years they just kept saying wait as long as you can, and after about 10 years of that I finally had just said I'm ready.
Yeah.
And it worked. I mean,
That's awesome.
from what I was feeling before to what I am now is 180 degrees different.
That's great.
Yeah.
I get asked a lot because chiropractic people think of it, as a profession that doesn't like surgery, and that's not true for me. What's true for me is doing the next right thing. So if someone has back pain or sciatica, or like he was saying, the bent over body, and the first week they go right to surgery, I might say that might not be the next right thing to do. So the next right thing might see what else you could try first.
Yeah, they did a bunch of blocks first, and
Yeah.
what happened was they were working for a year and a half, and then it worked for a year, and then it worked for 6
Right.
months. So it just
and then it became inevitable.
And then so it just at a certain point,
Yeah.
I tried a bunch of alternative things before to the
Yeah.
point where we finally just realized, okay, you're there now.
Yeah, and
So
there's
that's-
not a month that goes by in my office in my 23 years of doing this where I don't eventually say to a patient, it's time to do surgery. But I love to first see what we can do without surgery if there's a little room. Like if they're in such excruciating pain they can't even. I had this one guy that actually, he lived in a 4th floor walk up. So if you guys don't know that, depending on where you're watching from, means no elevator in the building. And his back was so bad that the ambulance had to come and take him in one of those gurneys. But they had to carry that gurney up 4 flights of stairs in New York City in an old building to take him to the hospital. And he called me up and he goes, should I come to your office? I go, no, don't come to my office, go to the hospital. Because that's not a good case for me. A good case for me is someone that can still get on my table and we might be able to work a little bit. And over the years, I've taken some people and avoided surgery, but also some people, the next right step is surgery, and you went on your own journey.
But for me, it was the right call after
Yeah.
being patient to the point where it was really affecting my energy level, my pain in general. It was messing other things up to the point where then it was just
right. And
inevitable.
him being a high level athlete, he knows his body, so it gets to a point where the next right move is going to do that. And you had success with this, so that's great. But the way it's going to show up in today is that I'm not going to do the side twist thing because that wouldn't be appropriate. It would be contraindicated for me to do that type of adjustment with his history of back surgery. So we're going to get started. We're also going to do some cranial facial release today. Now, you said you've broken your nose before, and to come up close, you can see his nose is bent a little bit. So it has the high side of the rainbow is right here. Mm-hmm. Now, if you hold one side of the nostril at a time, is there one that's harder to breathe?
So right side is blocked.
left side today is better than
So the right side's worse.
yes
Today.
Today.
So we'll probably start on the left side, and we'll just do a cranial on each side, cranial balloon technique release, and see what we get. So we're going to start with you, and you have a lot of neck tension. Is really the reason you came in today. So let's start with you. Face up, please. You're going to be on your back. I know that introduction was a little long compared to some of my videos, but I think it's important because I don't always have people in my videos that did have back surgery, and I think people incorrectly assume like, oh, just get a big chiropractic adjustment and it fixes everything, and that's not true. Chiropractic is really a process, not a procedure. A procedure would be a one-off thing where you just get like, your back cracked and everything's better. But that's not what chiropractic is. It's a process. It's something you chip away at. It's something you do over a period of time. It's something that you do, you know, and you build into it. And you do as much as you can on every visit, which I always try to work on someone head to toe. But you can't like just reverse someone that needs back surgery with one miracle adjustment. So right now I'm digging into his muscles of his neck. How does that feel, Sky?
It's good. On the other side, I can feel it pressing on my lower, but I can feel it almost behind my eye, and I can feel it up here.
So this one here,
Yeah.
And what I'm feeling here is there's a wicked muscle knot right at C3, C4, and that's the one that almost radiates up to here, right?
Yeah. Yeah, it's like up here.
All the way up here.
Yeah.
So that's pretty amazing how connected our body is, right? So
Yeah.
you can push on one muscle.
Yeah, it feels like you're pressing your thumb on the top of my head also.
Years ago, here, put the camera on me for a second. Years ago, I shared an office with this amazing acupuncturist. It was probably 10 years ago, and I threw my back out lifting weights before. I used to go to the gym at 6 in the morning before work, and I was deadlifting, and I threw my back out really bad, and I had 25 clients that day. So before we started work, I went to my acupuncturist colleague, and she only put one needle, which was in the back of my knee. Back pain went away. I worked the whole day with no pain. But think about that. She fixed my back from behind my knee. Weird stuff, but it worked. Weird meaning I would have never thought that that's where you'd put the needle. I would think you'd put it in the back for the back, not the back of the knee for the back. But it's just an example of how interrelated different pathways on the body are, energy, meridians if it's acupuncture. I'm not doing acupuncture now, but you push on one spinal segment and you'll feel pain at the top of the head sometimes.
Yeah,
It's intense, right? So actually, this is a really good spot to do the occipital lift because I was just on C3, C4, but as I come up, the occipit's locked on this side too. Do you feel it? So,
I just know that I feel stiff, so you'd have to tell me, but-
so we're gonna have you sit up. We're gonna do that next. I think your wife wanted to see this too, right?
Yeah, both of us.
So what's your wife's name?
Charlotte.
Hi, Charlotte. I'm saying hello right now. Thanks for sending Sky to me. Scoot forward. Now, she was the one that was watching Instagram at one point, right?
Yeah, well, we both. I mean, it was me. She's doing her work, and now I'm showing all these videos of people moaning and groaning, and she's like, "What are you watching over there?" I was like, "No, this guy's saving people."
All right, move forward a little more because I'm going to climb behind you. All right, Charlotte, this one's for you. We're going to do an occipital lift, and we're going to go up under here. Turn your head, tilt it over.
Oh,
Got it.
months for that. That's great.
That's an occipital lift. And you could hear that crack.
Yeah, it feels like you're chewing on pasta shells, raw pasta.
Now, what was funny when I first met you, you said it sounds like it's all mic'd up, but didn't that sound loud in your own head?
Yeah. Wow.
So, Lion, and we do have
And
a nice
it's interesting
microphone.
that you think that it might be painful, and it's nothing of the sort. It's pretty incredible, actually.
Because if you get the right spot, it's really clean. Like it just releases, it's intense, but it does the right thing.
Wow.
Lie on your back. Let's push that spot back at C3, C4. So the spot that I pushed with the muscle knot was like an inch lower than what I just adjusted at the occiput. But that was the spot that referred faint pain to the top of his head. So I'm going to dig in really deep here and see if he feels it the same way to the top of the head. Do you still feel it? I mean, you can. Don't lie.
I can. Maybe it's just because you're pressing on.
Okay, so now I'm going to adjust this directly. So I haven't done this one yet. Let's get it from this side. All right. How about now? And you're allowed to say, I don't care if I get it, it's a process, like I said. Does that refer to the top of the head?
A little less intense, but it's still there.
All right, so
but like I said, I've been so stiff for so long. It might take
It might take more than one.
Sure.
Lie face down. We're not done yet because I have another way to work on that spot, and I'm going to use this adjusting instrument that doesn't make any pops, but it's very accurate. And do this first. Turn your head all the way to the left to this side, and then turn all the way to the right where you went originally. And which side is it tougher to turn?
This way.
Okay. And when you turn that way, point to the bad spot. So we're going to do that spot first, okay? Lie face down. And we're going to do this one, and then this one. And I'm also going to get the one that I was working on the other side, okay? Okay, now turn to the right, which is this side.
Better.
Good, and now turn to the left.
Good.
Good. So now flip on your back, and I'm going to push into that muscle again as it refers up to the head. And hopefully it's less.
Less.
Okay.
But again, it's there.
So we're working. There's more to do. Now we're going to strap your legs in. I don't know if Charlotte warned you about this, but this is the next part of your journey.
All right.
And we're going to stretch that a little and decompress it, okay?
I've seen the Y strap.
So first we're going to stretch a little bit, which pulls the pressure on those nerves and decompresses it. And I'm not going to do a savage Y strap, okay?
Okay.
Because you did have surgery. I don't want to pull it all the way to the back. I just want to do the neck, okay?
Yeah.
So I'm going to just do the neck. Big breath in. And as you blow it out, I'm going to pull.
Felt a couple of crunches in there.
Let's do one more. Big breath in and blow it out. That was a big one. Okay, so did you hear any crunches or pops or separation?
Crunches.
Good. That's what I wanted. Now we go back and push that muscle one more time, and then we're going to leave it. Referring to the head?
No.
Okay, so we got gone or a little left?
Like almost gone.
Okay, and I'm pushing really strong, aren't I?
Yeah.
Okay. All right, scoot down this way. A little more. So that's kind of cool. So we took pressure off that nerve.
Yeah.
And that was a big pop in his upper thoracics.
Thank you for that.
You're welcome. And you can do another one. Big breath in. Good. There's another one. Good. Let's do one more, and then we're going to do some cranial after this. That one's fine. So now lie face down. So you were a pitcher, right?
I was.
Yeah. I have to say that out loud because otherwise people in the comments are going to say, what position did he play? So now we know. Let's try this, okay? I'm going to have you lift this leg up, but keep it long, and then put it down. So do that again all by yourself. Lift it high and put it down. And then lift this leg as high as you can. Is there one that is more difficult or more challenging or creates any muscle spasms?
Feels like the left is tighter.
Tighter.
Or harder.
Okay. So I'm gonna dig into that side with my elbow, okay? Is that too much or does that feel okay?
That's good. I felt a small little pop.
A little crack, right?
Mm-hmm.
So just by putting this pressure, he felt a little, and that wouldn't be a deep part of the joint. It would be probably just the facet, which is a smaller articulation releasing. And the facets make littler pops.
And those are the procedures that I had done, the facet blocks before surgery.
Right, they shoot into them, right?
Mm-hmm.
Ooh. So I'm just on these tight muscles. Just doing some elbow stuff. Good. Now I know you live in Europe now. You live in France, right?
I do.
Yeah. So I guess I have to get to France and do some videos.
There you go.
I have someone that watches this channel named Vega, and she lives in the UK, and she likes the elbow stuff, so I have to go visit there and do the elbow with her. And I have a friend named Nick who lives in Germany, and she likes the elbows. And I have a friend named Jeff who lives in Rhode Island. Hi, Jeff. And he likes the elbows a little bit, or maybe he just likes the big thoracic ones.
God.
And I think my friend Kenneth from Sweden wants the whole thing. He's a power lifter.
Oh, God. It's painful.
So these hurt, right?
Yes.
All right. Now lift this left leg again. See how it feels now.
Oh, wow.
What do you think?
A lot higher.
A lot higher.
Less. It's funny, you lift here, but then it felt like it was tighter here and it's looser.
Good. So let's do that right side one more time. Good. And now I'm going to do a little bit of an adjustment that's safe, which is just the drop. And I'm just going to go through the base of the sacrum, not even on the side of a surgery. Good. Okay. Try the left leg, then try the right leg. Should be nice, right?
Yeah.
Good. So I'm going to have you turn over. We're going to do the cranial now.
Okay.
And there's a couple of pieces that we do. First, this goes under your neck. So your neck is relaxed and at a nice angle. And we're going to give you a few tissues because sometimes it makes your eyes tear.
Okay.
And then we also have our famous floppy that you hold on to.
Oh, okay.
Which is our support animal. And it actually was my daughter Lily's. Lily's 25 now, so she doesn't really use floppy on a day-to-day basis, but she donated floppy to the cause.
She might have a flop that you don't know about.
She might have one that she doesn't tell me about, but Floppy grew up with her, and now Floppy's here helping me. All right, so you said that today the left side was more difficult, or the right side? It was a long time ago, so now I don't remember.
It changes. Right side is more stuffed.
All right, so let's start on the left side, okay?
Mm-hmm.
So here we go. I'm going to put this back in, then we'll have you here. When we do it, you'll open your mouth really big. Here, look at me, everybody. And then you seal your mouth off. Okay. And that's when I go. Okay, but I'll follow you. You'll let me know. So here we go. Here's getting it in there. Wow, it's a little tricky on you.
Yeah.
I think you really did break this nose a few times.
Uh-huh.
Sorry. There it goes. I finally got it.
Oh.
I think that'll be enough. So I have to fill it a little bit, okay? Do you feel it fill? So when you're ready, you open your mouth and then close it all the way.
Oh.
One more.
Oh.
Stop. It didn't go through in the first blast, so I had to do one more. You might need the tissues. Could you hear cracking?
Crunching.
Crunching.
Wow.
And that side was messed up. Here, you can look at me for a second. So that side was blocked. It was really hard for me to thread this through, and the more I do these, the faster I'm getting at threading them back, because I'm getting better at it just with repetition. And that one was tough. He definitely had a broken nose at some point. And but you heard cracks here.
Oh my God.
Here, sit up for a second, and I'll give you more tissues also.
Wow.
What did it sound like to you?
Just crackles.
Yeah,
But
multiple, right?
Multiple. Holy wow.
And it's
That's just years of just. Yeah.
yeah, and
intense.
those bones are supposed to move. We're still going to do the other side, and while he's clearing his nose, one of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension, and the dura is like the sac or sheath on top of our brain and spinal cord. So it releases some of the pressure around that. And think of the casing on a hot dog being too tight. And we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage, and some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma, and it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. So we're still going to do the other side. And try the breathing right now, though.
Can I blow my nose?
Yeah, so let's don't watch him blow his nose. So,
Oh, I don't care.
and we're gonna go do the other side, which today is his worst side.
Oh, boy. That was intense.
And Roger, you can be on him.
Yeah. Wow.
Are you ready?
I don't know.
Charlotte, what the hell? You sent him for this stuff. All right, so let's grab a few more tissues. We're going to just do the other side and just get it done. It's not easy. I did 6 rounds of this in 3 days, and it's, but it's satisfying to get it finished. And I guess, I just have to be determined, like, it's uncomfortable, but you either want it done or you not want it done.
Yeah.
So let's just do the other side. Let's just get it done. And so now we'll be on the right side, and hopefully this one threads back a lot easier. You see, Floppy does have his part in this because you get something to squeeze.
Yeah. Oh man. That was nuts.
The noises that it makes is insane, right?
Insane. You kind of almost feel like things are breaking.
They're cracking, and so here we go. Ready?
I don't know.
Oh.
This one's going in. Almost there.
Oh. Oh.
1 second.
Oh. Oh.
Got it.
Oh.
One more time, because I wasn't ready. Did it on 1. You're a brave man.
Brave, not smart, smart. I don't
I
know.
didn't say smart, I said brave.
It's interesting because when you feel the balloon, you
Yeah.
feel it blocking. You almost feel like you like you're breathing, you feel the balloon in there. It's pretty interesting.
Yeah. It hits resistance, right?
It hits resistance, and all of a sudden there's no resistance. It's really a trip.
Through. Did you hear cracks on that side?
Not as many as that side.
Yeah. It turns out I think the left side was worse than the right as far as structure goes.
I could taste the balloon too.
Yeah, the balloon is latex.
The latex balloon.
And you'll taste it. Here, you can sit up now. But in your case, I think structurally, internal structure, his left side was much worse than the right. And I can tell that a lot by...
you feel, sorry to interrupt, but you feel for so long, the blockage, and then to feel that expansion there, even for that short amount of time, is, in a weird way, it's uncomfortable, but yet relieving at the same time. It's interesting.
Yeah. There's a series that I'm doing with this woman named Katie, and the first video is 20 years of a broken nose blocked her. And now we've done 5 with her, and she's like 95% has breathing now. But she had 0 breathing on the left side from, she was doing cheerleading, and the person that flies in the air, she's the one that catches it, and her cheerleading partner elbowed her accidentally and crushed her nose. They straightened the nose, or not surgically, in the doctor's office they straightened it, but she never had the inner part straightened. And it took 4 or 5 of these on her.
Wow.
So usually we tell people it takes an average of 4 of these treatments, but you're going to get a lot from one treatment.
I can feel it already.
Yeah. So
just the inhale, I can feel breathing up higher in my sinuses than I have in a while.
So we got that upper chamber. I targeted your left upper, by the way. I did your right middle and your left upper. I didn't say that out loud, but no. And so that's why it opened the under the left eye.
Wow.
I did this person not on video. This is my friend Marnie, and we didn't shoot a video, but she felt actually her eye socket crack, and I went up to the upper chamber, and she felt like it go like behind her eyeball. So those are movable bones too. Thanks for watching. Anything left to say?
No, thank you. Came a long way. So
all right. How's your neck feel?
Feels good.
Right.
I mean, range of motion is better.
What was your favorite part today?
The lift.
All right.
Yeah,
good.
for sure. And meeting you, of course.
Thanks. All right, cool. Thanks a lot. So when you're ready, you open your mouth and then close it all the way.
Oh.
One more.
Oh.